everyone. It took us a minute in magic land of Instagram, but here we
You know,
are.
only mild technical
Only
difficulties.
mild. It's
Big
mostly
win.
me. It's mostly me. Well, I'm so glad to see you. Happy holidays, everyone. I hope everyone's had a phenomenal week. I'll quickly introduce myself. I'm Christy Brown. I'm the CEO here at Dr. Knows Best. And I'll pass it over to Kim to do a quick introduction of her.
Absolutely. I'm so happy to be here with you, Christy. And I'm Kim Grenawitzke. I'm one of the senior feeding therapists over at Solid Starts. And for anyone that's unfamiliar with our side of things, our entire platform is about helping families confidently transition to solids and then deal with all of those little funky eating things that happen with your kids as they get into toddlerhood and beyond. So I'm really excited to be talking to you today. We had a great catch up earlier in the week to talk about all the things that parents have been asking both of us. And I think we're going to hit on a lot of really important topics today.
Yeah, I agree. And I think some of those, as I shared with Kim, are early mothers who are just simply asking during this wonderful time of the year of sick season, how do they even treat themselves as well as their children? So it's something here at Dr. Knows Best that we talk about all the time, you know, in the high lows of respiratory and sick season. How do we not only take care of ourselves, but addressing the illnesses and feeding and swallowing and so on and so forth. And that's Kim's specialty. So I'm super happy to be here and help guide through the conversation. But why don't we kick off and learn a little bit about each other and then maybe take some questions along the way. But I'd love to address maybe some common concerns from your side, Kim, that you're seeing, especially this time of year, but overall, when parents have their baby and they're sick or recovering from illnesses, like, are there specific things they can take, what they should be doing? I know there's an ongoing list, but I'm going to toss it your way and see maybe about some advice you could give.
For sure. And I'm going to start off also by saying I am recovering from some sort of toddler cold that I got.
I wasn't going to mention it.
So I thought by the end of the week the cough would be gone, but alas, it's still here. So everyone, I apologize already if I need to take a moment and cough, but because of course I have a 2-year-old and a 4-year-old at home who bring all kinds of lovely respiratory illnesses into our house. So for anyone that's sitting in their living rooms right now with sick kids, we understand and we see you. So before I got involved in Solid Starts, my entire practice was actually in hospital-based pediatric care. So I worked primarily in the neonatal intensive care unit, the cardiac intensive care unit, helping babies and families figure out how to eat, right? And that could be that could have been breastfeeding, that could be bottle feeding, that could have been solids. But my work very much specifically focused on safe and happy, which I know is a hard topic to come up with when your baby is sick. Eating relationships. So that also got me into lactation. I'm also a international board certified lactation consultant. So I will share some information today as well from my perspective as a lactation consultant, and then of course as a swallowing specialist, and most importantly as a mom, because I can give you all the best advice in the world, but if it doesn't work in real time with your baby, it doesn't really matter. So I think one of the things that we hear a lot from families is, especially in our younger babies, so our 6 to 12 month olds, when they get sick, they just simply don't want to eat. And what should we be doing? Should we be, encouraging them to eat? Should we be giving them only their favorites so we know that they get some food in? What's the approach? What should we do while we're in that active, really don't feel good phase? So something that Christy and I were talking about earlier when we were checking in for this live was just the idea of safety with eating. And something that at Dr. Knows Best, you guys obviously know very, very well, but there is a very, very deep connection between breathing and swallowing. So I'm going to give you a little mini anatomy lesson, everybody here, but nothing too much, I promise. But every time we swallow, we actually have to hold our breath, because when we hold our breath, that keeps food and liquids and things from going into our breathing tube. So every time we swallow, we actually have to stop breathing for a second and then start breathing again. Well, if your baby, especially a teeny baby that has tiny little nasal passages, is having trouble breathing already because they're super snotty, they don't feel good, they're coughing, that extra second of having to hold their breath while they swallow is a lot of work on their little systems. So the NICU therapist in me was always a big fan of if they're snotty and they're congested, let's figure out a plan that we can make sure that this baby is safe while they're swallowing. But when we're thinking about our babies at home and they're 6, 7, 8 months old, they're just kind of starting to get the hang of solids. They're not really taking a whole lot anyway. It's a whole brand new skill for them, right? Whether they're spoon feeding or they're feeding themselves, it's all brand new. And now we're adding this additional stress of tons of mucus, stuff pouring out of their nose, difficulty breathing, and we're asking them to do something even more challenging on top of that. For a lot of kids, that extra need to hold their breath and swallow while they're trying to coordinate just simple breathing and existing at this point is just too much. It is 100% okay if your baby is sick to just say, you know what? We're just going to not put solids. We're not going to have solids on the table for the next few days. It is 100% okay to just skip. Your baby is working hard to breathe. They probably feel crummy. All they want to do, I'm assuming, is cuddle up on you and just start to, feel better. Don't worry about solids. Focus on your breastfeeding, focus on your bottle feeds. Just make sure that they're staying hydrated, and you can get back on track with solids later. But that's definitely my number one thing I tell families. Try to not sweat solids when your baby is sick.
Don't you feel like patience, also encouraging the patience of,
oh my gosh,
it's not going to be perfect. All these things don't work. I mean, like you just said, for each parent, and, a snotty nose also means they're not able to breathe through their mouth, and they may not eat and sleep. And so that's something we talk often about at Dr. Knows Best. And it's certainly why we were created, is to help, suction the nose in a fast way that allows them to breathe better. But it's really, how can we support the parent too when, especially a first-time parent? I mean, you have 2 kids, Kim, but when we think about that panic mode of first-time parenting, of what do I do if my baby won't eat?
Mm-hmm.
I think that is such a liberating aspect, to be patient with yourself and learn that it's not 100% all the time. So what do you think about when you think of, or what could you offer from an advice perspective for feeding the hyper congested baby? Maybe you do get them to eat, you're saying no solids, but as a parent, and I brought this up earlier, if you're taking Tylenol, or the doctor has prescribed something, which doctors typically ask, are you breastfeeding? What kind of tips or offerings could you give to our parents to help talk about the feeding process while you're sick as well?
Oh yeah. So me as the sick parent over here too, I just recently stopped breastfeeding, so I'm just was in this realm of things, but I'm going to speak to this as an IBCLC, and I also, of course, always want to say, if you are prescribed a medication, if anything new is put on the table for you, it's important to chat with your medical provider about it. Some adult medical providers are comfortable talking about breastfeeding and medications, and some are not. You can always ask your child's pediatrician as well. So especially for prescription medications, you want to run that by them. But there are some general considerations that, as an IBCLC, I feel comfortable sharing with you, as well as some online databases that you can do your own research to look up medications that you're on. Now, generally speaking, your medications like acetaminophen, and so your Tylenols, your Motrins, your Advils, those medications typically are safe with breastfeeding. So if you have a fever and you're taking some Tylenol or Advil for that, generally speaking, there should be no issue with you breastfeeding your baby on those medications. Now, something that's very important for every breastfeeding parent to keep in mind, but especially when you're sick, is make sure you're continuing to hydrate yourself, because it is very, very challenging to take care of your infant when you're also not feeling good, taking medication. Make sure you're continuing to get fluids in you while you're recovering from your own illness. Now, I've also heard families worry about their own nutrition while they're breastfeeding, and when they don't feel good. Do the best you can. It's not a perfect science. If you have a week of eating, white rice because it's all that sounds good to you, or if you have a week of eating, toast or whatever it may be, because that's what feels okay to your belly, or that's what feels good to you while you're recovering, it's completely okay. Try not to worry about the fact that your baby, the food that you're putting in your system is not absolutely well balanced and quote unquote perfect. That's not going to affect your baby's breastfeeding relationship and their weight gain, etc. So you take care of yourself, do what your body needs. Your typical over-the-counter fever reducers are fine. Now, a lot of families ask about cold medications. So things like Tylenol colds, Sudafed, those kind of medications. Typically, these are not recommended in breastfeeding, specifically because they can affect your milk supply. So if you are going to want to take decongestants, or any of those medications that help with getting rid of some of that phlegm and things, you do want to review or discuss that with your medical provider. One of the things that was always told to me in my training was it's a cost benefit analysis, right? It kind of depends on where you are at with your congestion, how do you really need this to help with your breathing, and what that could potentially do to impact your milk supply. So always review those with your medical provider. Now, if you are given something or you're looking at medications at the grocery store, one thing that a lot of lactating parents will take that is typically safe in breastfeeding is Mucinex. It's, in my opinion, it hasn't really been super helpful for me when I've been sick, but for some people it works really well. So that's one of those ones that typically does not affect your milk supply and is safe with breastfeeding. Now, if you want to look up your medications, and I think this is the coolest thing, you can go to the LACT-Med database. So it's by the National Institutes of Health, and it's LACT MED. You can just Google that, LACT-Med, and you can actually type in the name of the medication that you're taking, and you'll get a whole one sheet that gives you all the information on the drug. Now, sometimes it's not clear. It doesn't say like, yes, for sure, this is something you can take, but it'll tell you what the risk level is, what the drug could potentially influence, and whether or not that's going to cross through into your breast milk. So even if your medical provider, your physician's not knowledgeable about this, they can look up the drug on LACT-Med, and if there's any sort of really big chemistry kind of things that are on there, because it does give you some really detailed information, they should be able to help you translate that to make a good decision for you. So again, typically speaking, your fever reducers are fine, and then you want to look up anything else on your LACT-Med database, and keep in mind that your decongestants many times will impact your milk supply.
And then talk to me about, or talk to us, I should say, because we have many people here other than myself, although I'm completely intrigued with the conversation as well. Should breastfeeding parents really increase feedings during illness? So you just kind of highlighted your baby may not feel like eating. Should we keep trying, every 30 minutes or what have you? I mean, how do you feel about that if your baby's just not ready to eat during illness?
Over to the other side, so thinking again about your baby being sick, one of the things that can be super helpful is to feed your baby more often and for shorter periods of time. So like Christy was saying earlier about the congestion and the nose and not being able to breathe, sometimes that coordination of breathing and swallowing for 5 to 10 minutes is really all they've got in them. And so they're only taking these really short, frequent feeds, and that's okay. You might notice that your baby is kind of nursing like they did right when you started nursing, that cluster feeding that every early lactating parent can probably remember. And I mean, I feel like I have my own stress response thinking about those times. But some babies really do want to nurse really frequently. In addition, breast milk is very calming to baby's body, and it has analgesic properties, so they might just feel better when they're nursing. Now, you also may want to do a little bit of a nose suction before putting them to breast, especially if they're super, super congested, because they are needing to breathe through their breast breathe through their nose while at the breast. And if they can't get any sort of air in, they're going to really have a hard time expressing the milk and swallowing it. So typically I'll tell families, do a little suction, whatever they're comfortable with. And I think this would be a great time for you to talk a little bit about safe ways to suction. And I've definitely seen, and I've done it myself. I have stuck that suction thing up my toddler's nose and just gone to town with it. But gently clean out the nasal passages. I was always a fan, and maybe this is just the lactation consultant in me, of squirting a little bit of breast milk in their nose first. And that might be totally wild to most people, and I have no idea where I picked that up, but do a gentle suction, go ahead and put them to breast. And then again, you might see that they fall asleep really quickly and they don't have a lot of energy. For babies that are really, really ill, especially if they have gastrointestinal viruses and they're vomiting, they're having diarrhea, I would recommend reaching out to a pediatrician earlier rather than later in those situations, because you don't want your baby going more than 6-ish hours without getting a decent feed. If you're noticing that you're seeing less wet diapers or no wet diapers at all, you're noticing their fontanelle is sunken a little bit, so that little soft spot on the top of their head is kind of starting to get a little bit of a divot, worth reaching out to the pediatrician. They may recommend something called an oral rehydration solution, but if you notice that your baby's really not taking anything and it's been about 6 hours, I would absolutely give the pediatrician a call.
Yeah, and I want to bring up, since you mentioned it, safe ways to suction. So often we recommend to parents to put a little bit of saline. Your flavor's breast milk. I have not heard that, but I love that. I think that is such a great, like, what do you call it? A kind of mom's hack, right? So that's a great mom hack. But a little bit of saline just to wet the inside of the baby's nose so you can extract the boogies much faster. We have 3 speeds of suction, so we would typically start on the lower end to try to loosen it up. But certainly, you know, depending on how congested the child is and how dry, you definitely want to use a little bit of saline. Don't over saline. We do have very aggressive parents who just want to get the job done. I'm one of them. I'm sorry, I'm very type A, but it doesn't mean you have to fill the baby's nose full of saline, just a little bit. And then certainly, you know, suction on the outside instead of putting things on the inside, so you don't damage the membrane of the nose. So just some important things to realize. I'm going to flip the script just a little bit because I think something that we started to lean into that I'd really like to talk about, it's a huge focus for me personally, is just that mental health focus of guilt or shame when the baby's not eating. I know I kind of introduced that in the beginning, but it's just a very personal, you know, kind of path that I've been on, and just how do you manage those feelings, and what advice maybe that you have as a feeding specialist to say, hey, mom, it's going to be okay. And, you know, I know this is taking a toll. You feel like you're not doing your job, but all the different components that come along with that, and combine the fact that postpartum is such an issue. I'd love for you to spend a few minutes on this because I think it's really important.
Absolutely. And if I could advocate for one thing, moving on for the rest of my life, it would be better postpartum support for families and babies. This is a very loaded topic, of course, and there's so many components here, but yep. I feel very strongly that the systems are not in place to support postpartum parents, whether that is moms, dads, grandparents, whoever it is that are taking care of new babies. And new babies, yes, they're made for new parents, but they are so hard. And there is so many components of keeping that little infant alive while also trying to keep yourself alive during one of the most challenging parts of your life. So when it comes to feeding babies, and this is one of the reasons I love the work that I do so much, there's so much riding on it. And from the moment you find out you're pregnant, this baby is getting measured and essentially getting weighed, right? Every prenatal appointment you go into, they're measuring how big the baby is. And I had one very small baby and one very big baby, and I had both issues in my prenatal appointments of, oh my gosh, what am I doing that's making this? Why is my baby not growing? What's going on? Am I not eating? Am I not taking care of myself? What am I doing that's impacting this? And I had the flip side of, why is this baby measuring so big? Am I gonna end up with a C-section because this baby's so big? Am I eating too much? Am I not managing my diet? What am I doing? Neither of which had anything to do with the baby. It was just how she was growing. But from that moment you're pregnant, your baby's getting measured, and your ability to parent is being defined by how that baby's growing. The first thing they do when you bring your baby into the pediatrician's office on their 2-day appointment is you weigh them. They do the same thing on their 4-day appointment. They do their same thing on their 1 week, their 2-week appointments. Every baby visit you have, and I mean, into childhood, the first thing they do is weigh them. And there's so much of a feeling of responsibility for what that number says on the scale. And you feel as a parent so dedicated to, I need to make sure this number is right, or this number is in the right percentile, or it's very easy to get in your head there's a certain number that's correct. And based on our history, based on our own upbringing, based on our family dynamics, some families really want their babies to be in super high percentiles. Some want their babies to be in super low percentiles. Some really don't feel comfortable unless the baby's right in the 50th percentile. No matter what that number is, we're looking, or the medical community in general, their goal is to see that your baby is growing. And we want to see that they are growing along a curve. I know that we all define our success in baby growing right or growing at the right number. But the reality of the situation is there just isn't a right number. So if your baby is born at the 4th percentile and they grow on the 4th percentile, that's just the size they are. Your baby may be born at the 98th percentile and they stick at the 98th percentile, and that's how they grow. They may do the same thing at the 50th percentile. Those numbers are just a system to track how they're growing over time. It's not a grade. So if you can tell yourself the number on the scale is not a grade about my parenting, it's not a grade, it's just how my baby is growing right now. It's one data point that we're using to look at your baby's overall health. That would be something I would try to internalize. Now, I know it's not possible to hear that and say, okay, I'm going to walk away and not worried about my baby's eating and their growth. But know that that is one data point that we're looking at. So every baby's going to grow a little bit differently. They're going to grow at different rates. What you fed your baby on Monday is not going to, or like what happens with them on Monday is not going to necessarily impact the trajectory of their growth over the next 6 months. Every day is a new day, and we're looking at growth over time. So feeding in general, especially in those early days when you're just trying to survive, is really challenging. The
survival is key.
Literally survival is key.
Yes.
If you are lucky enough to have support, whether that is from a partner or family or friends or anyone that can provide support during that time, try to take advantage of it. Now, that might mean I'm going to go upstairs with the baby and just nurse them for the next 6 hours, and I'm going to let somebody downstairs in my house do my dishes and make me some macaroni and cheese or whatever that may be. Or that might mean I'm going to let someone clean my pump parts. Or that might mean I'm going to let someone, or I'm going to help someone give the baby a bottle. It's up to you to decide what you feel would be helpful and then try to advocate for those things. Now, I completely understand most people come over and they want to hold the baby and they want to feed the baby. And especially if you're a lactating parent, that can be really challenging. The first time I had a lot of family come visit my firstborn, I actually got mastitis because she was getting passed around so much and I wasn't nursing her frequently enough. And she was a very highly sensitive baby and nursed and nursed and nursed constantly. And so I completely understand that urge to want to make other people happy. And the only thing that's going to keep us afloat is to remember that we need support, and they are coming to help support us. So if we can try to vocalize, and maybe it means before they even get there, writing a list of 5 things that you could really use help with, or asking your partner to help communicate those things to their guests or the guests or whoever it is that's coming into the home. But know that you can only do the best you can. And if you end up excuse me, if you end up with a goal of breastfeeding and it just doesn't feel like it's working out right for you, something doesn't feel right, you've gotten the support that you need and it's still not working, there are other ways to feed your baby, and that's completely okay. And that could mean pumped milk, that can mean formula, that can mean a combination of both of them. My biggest concern as a lactation consultant is not about whether you breastfeed, it's whether you get the support that you need to be able to make the decision that works for you and your family. So if you really want to breastfeed, I want everyone to be able to have the support of a really good quality lactation consultant that can come in and help problem solve that with you. And if it ends up coming to the conclusion that it's not going to work out, I want you to feel good about making that choice. On the flip side, if you feel like breastfeeding is not something that you want to do and you want to go directly into bottle feeding or you want to do a combination, I want you to have the support, whether that's from your partner, your pediatrician, society, social media, to say, this is what's working for me. My baby's getting fed. That is the end goal. Along with this whole, I wish everyone had the best postpartum support in the world. I think having good feeding support from lactation to also bottle feeding support, because bottle feeding can be tricky too. For anyone that's bottle fed from the beginning, it's not always super easy. I'd want professionals to be able to be available for people to help make these decisions in a comfortable way. Sorry, I feel like I went off on like 5 different tangents
No,
there.
I love it. I think that's, part of kind of where I was going too, is just my wish also is that we could access, postpartum support in a much broader, bigger way. I think, over the past couple of decades, we're just now starting to talk about it, which is a shame. We are thousands of years into humanity and we're just talking about postpartum. So I would love to think, along your journey and where you would recommend resources potentially that others could access, not just around maybe postpartum journey, but cumulatively with a feeding challenge that they may have. You mentioned a few things earlier, but are there other resources that we could recommend to parents who are with us today?
So anyone that is interested in breastfeeding, honestly, they also have support for any sort of feeding method. Is La Leche League is great, and they have a lot of in-person support groups, which can be wonderful. Many community hospitals also have breastfeeding and bottle feeding support groups where you can just show up with your baby and sit around with a bunch of other parents that are experiencing the same thing, because sometimes just saying, I just need someone to talk to about this can be so helpful. My first was born in COVID, which was one of the most interesting times to be early postpartum. I was also working in the hospital, so just lots of anxiety in general. And I felt very lucky that there were 4 women all in my department that all had babies at the same time. So we could kind of be our own little pod. And when we were going through similar challenges with eating, and most of us were feeding specialists, so these were things that we were supposed to know. And we'd still be able to hop on FaceTime or go to a park and sit together and problem solve these things together, because sometimes you just need an outside set of eyes. You just need someone to be like, do you notice that, the baby's barely attached to you right now? And you're like, oh, I didn't even see that, right? You just need someone to like look from the outside to help you. For me specifically, there was a lot. My first daughter, again, I had mentioned, very highly sensitive, never slept well, still doesn't sleep well. And I needed somebody to tell me that that was okay. I needed somebody to tell me that there was nothing wrong with me. There was nothing wrong with my baby, that she didn't, magically sleep all these hours at night like the internet told me she was supposed to. And that was sorely lacking for me. There really wasn't a lot of support for me around sleep to understand that not every baby sleeps like a baby, and that I didn't break her, and that, she would sleep. Maybe one day she'll sleep. We'll see. Maybe when she goes to college, she'll sleep. But for me, it was definitely sleep, and I'm sure everyone's got their little topic that probably hits home really hard for them. So sorry, going back to the initial, La Leche League, community hospital groups are great. If there is a breastfeeding or a pumping store near you, a lot of times they have free mom meetup groups that you can go to. And then while there's so much on social media that's really challenging, and we don't want to put ourselves in those buckets, there are also a lot of really great community-based communities, especially on Facebook and some of the other social media platforms, where you just can live in the same neighborhood. And so you can get yourself into that group, just again to start these conversations, to know you're not alone. What you're experiencing is not wrong or different. It's okay. And you can hear some tips from people to try. Now, keep in mind, when you're receiving information from anyone, whether that be a feeding therapist, another mom in your community, your mother-in-law, your whoever it is, take it with a grain of salt, because every baby is different. You can try things. It's okay if it doesn't work. And try to not beat yourself up if it's like, oh, well, they told me that this nipple was going to work for this, situation, and it didn't work for my baby. That's okay. Babies aren't robots. They're all different. Just because something worked for your neighbor's baby doesn't necessarily mean it's going to work for yours.
Hey, Kim, there's a few questions, and so I'm just going to lean into these, because I don't want to try to ignore anyone, but I know that they're hard to see as we sort through them. But here's one that is asking, her 10-month-old baby now has refused to eat for 4 days. I have changed the variety of food, but nothing worked. Is that related to teething? Question mark. She was excited for food before. Any suggestions for her?
Great. So 10 months, 9, 10 months is a very common time that we start to see food refusal because of teething, number one. And number two, if your baby's not already feeding themselves, sometimes we see food refusal because they don't want to be fed anymore. So if your baby is not already feeding themselves, this would be a great time to hand over the reins to them and allow them to pick the food up and bring it to their own mouth, or even hold on to their own spoon and bring it to their mouth. If your baby has been feeding themselves and has now slowed down or has decided they don't want to eat, it could be teething, or they also could have some sort of virus or something brewing and they're just not feeling great. Now, as hard as this is, and I'm going to say it, and I know that people are going to be like, oh, it's okay if they don't eat. Even at 10 months old, the best thing that you can do is maintain your normal routine. So bring your baby to the table, 2-3 times a day, whatever you do. Put the same food out that the rest of the family is eating. Allow them the opportunity to explore it. And if they don't eat it, clean it up. Wait 30 to 45 minutes and then feed them their breast or bottle feed. Now, you may think that sounds wild, but the reason that I tell you this is that getting into the habit of short order cooking, which means going back to the kitchen and getting them what you think they're going to want, replacing their food, putting out only their favorite, is a really hard habit to break. And if I were to give you the one thing that causes toddler selective eating and issues with toddlers at the table, it is short order cooking. So getting in the habit of just giving your baby the opportunity to eat and explore the food, let them choose to eat it or not. And if they don't, know that they can have breast milk or formula later, is the habit and the routine that you want to get into. Now, if you're a parent that's worried about weight gain, if you're worried about growth, a few days of them not eating solids is not going to impact their growth. They can always have more breast milk or formula. The breast milk or formula are much more nutritionally diverse, generally speaking. They're going to get more bang for their buck from the breast milk or formula. So try to remind yourself, solids, even at 10 months, is about learning. It's about exploration, and it's about them learning how to communicate. I want this, I don't want it. And then for you to set those habits and routines of, this is what we eat for dinner. When dinner's done, we clean up and we move on with our day. So I'm so sorry that they haven't been eating for 4 days, and I'm sure that that is just, killing your parent heart. But no, this is normal. It's definitely something that will pass. If you stick your finger in your mouth and you feel like you have some little, if you feel some little sharp sections, you feel like the baby is going to get some teeth in. Sometimes giving a cold teether prior to the meal can be really helpful. So put a teething toy in the freezer first and offering that can help. And if you are comfortable or interested, you can talk to your pediatrician about using some Tylenol or Motrin about 30 minutes prior to your eating situation to help with a little bit of pain relief before they get started. But chat with your pediatrician about that if it's something you'd like to do.
That's such great advice. Thank you. There's one other question that I'm going to lean into. Let me find it for you, Kim. What can we do for a 2-year-old baby having food aversion and gagging?
So gagging at 2 is a lot more complicated than what we think about a gagging like 6-month-old. So I'm going to tell a personal story here. I know I'm not 2, but I feel like this kind of made it click for me when I first became a feeding therapist. The first time that I ever tried uni, I was with some new friends, and we had gone to a restaurant, and I was trying to be really brave, and just having the texture in my mouth made me gag. And I did everything I could to try to make sure no one saw me. I was trying to keep my mouth shut. And then now, even just thinking about it or seeing it on a menu, I immediately gag. So gagging is the brain's response to not wanting something swallowed or towards the airway. So it's the brain saying, wait, something's not right here, and I'm going to gag. When it comes to a 2-year-old or an older child that's still gagging gagging at the sight of foods or gagging when food is presented to them, that's their brain saying, this doesn't feel right. I don't feel comfortable. I don't want this in my mouth. I'm going to gag to keep it out. So if they're gagging because they're chewing on food and they're not chewing it well and they're gagging and they're continuing to try, I would put that more, and they need to work on building some better chewing skills. But based on what your question was, I'm hearing this more as there's actually some underlying, your child has some underlying worry or anxiety for some reason about either certain types of foods or just food in general. with those kind of situations, I would always recommend some good one-on-one support to have somebody pick through what is it that's causing your child to feel anxious around eating. Anyone that's in the room right now, if you are a person that experiences anxiety, you may even feel that kind of feeling of, you might not outwardly gag, but you feel that kind of fullness in your chest when you're feeling super anxious. And many times kids, that same feeling of tightness and discomfort in their chest that we as adults feel with anxiety can come out as a gag. So that to me sounds like we would need to chase the why and maybe even track it back to, was there an experience where they really struggled to eat a food and they maybe coughed and really struggled to swallow it? Was there a situation somewhere in their past where they were really pushed or forced to eat food, and so now they're feeling really anxious about putting food in their mouth? Of course, there could be 10, 20, 30 reasons for it. These are just a couple that come off to the top of my head. But with those kind of situations, I would highly recommend chatting with your child's medical provider and ask for a referral for a pediatric feeding therapist. That tends to be an occupational therapist or speech language pathologist. And I would interview people if you can. I know sometimes there might only be one person in your area. You may only have one person covered by your insurance, but if you have any flexibility, asking about, specific, like describe your child's specific issues and make sure that that's someone that's trained in those specific feeding issues. Like, I'm just going to give myself as an example. If you have a child with autism, that wouldn't be a client that I would pick up because it's just not a specialty area of practice of mine. But if your child had a cardiac surgery as a baby, that would be something that I would feel very comfortable working with you on. So I feel like it's very important to ask the questions of what is your training in, what are your specialty areas, to make sure that you, if you have the option, find a fit that would be good for your child's specific presentation.
Such good responses. I also want to bring another question forward. This is from Kirst Renee. Thank you for asking this. I think it's a great one. I've had a horrible GI bug and I am so dehydrated. My 8-month-old is biting because she isn't getting any milk. We're doing bottles, pumping, but will my supply come back is what she's asking you, Kim, and what can I do to help?
Sending you so much love.
I know, so much.
That hurts my heart, especially with the biting. I had a biter as well, and it's the worst, especially when you're not feeling good. Number one, you absolutely can do things to help your supply return. Typically, in a lot of situations, as you continue to get better and you continue to stay hydrated, your supply will slowly increase. The thing that I tend to recommend, if you can handle it, because again, it just depends on how you feel, is to incorporate a power pump once or twice a day into your routine. Now, the idea of power pumping is to try to convince your body that you are cluster feeding a newborn. And so while you're trying to hydrate the best you can, and that couldn't be water, that can be electrolyte water like Gatorade or something like that, but just any sort of fluids that you can get into your system are good. Watch out for dehydrating things like caffeinated tea and coffee, because those are kind of defeating the purpose. But getting a power pump in, I used to do mine right before bed, but whatever time of day works the best for you. And honestly, when you feel your supply is the lowest is actually the best time to trick your body into doing this. Don't go wild if it doesn't work for you. But a power pump, you want to pump for 20 minutes, take a 10-minute break, pump for 10 more minutes, take a 10-minute break, and then pump for 10 more minutes. So you're going to spend an entire hour essentially pumping. But the idea there is that you're just convincing your body to make more milk and to make more milk and to make more milk. If you are not someone that's been doing a lot of pumping already, you might want to check your phalange fit to make sure that it's actually the right size. It's not uncommon for phalanges, especially most pumps come with a 24 millimeter flange. Not everyone's nipples are 24 millimeter flange fit. So if you are new to pumping, it's not something you do a lot, I would recommend checking it. There's lots of online photos that you can print out, and you essentially like put a coin next to your nipple and it'll tell you what size phalange you might want to use. But a good phalange fit is really important for getting more milk out. The other thing is massaging your breasts while you're pumping can also help, because pumping in general, or just breastfeeding in general, is all supply and demand. So if we can get out every single last drop of milk, that's going to convince your body to remake that extra drop of milk. So while you're pumping, and yes, the flange might come off a little bit, getting all the way up into your armpit up here and just doing some nice pressure down towards the nipple can help to get those last little bits of milk out. You can even do that in between your power pumps. So say you do your 20 minutes, you stop, you do your massage, get those little last drips out, wait, and then start the pump up again. That can be a great way to just really start getting that milk out. But I really hope that just as you start to feel better, things will slowly return to normal. You may even just throw those power pumps in for like 3 or 4 days to kind of get everything going again, and then hopefully you'll be back to normal. I'm so sorry. Something else you might want to try, if you do want to try to put baby back to breast, is pumping a little bit or hand expressing until you have your first letdown, and then putting baby on, because then if the milk's already flowing, you might not get as much biting.
Great ideas. I had not heard of the power pump, so I appreciate you sharing that. That'll definitely be a takeaway and recap for us here. One other question popped into our questions area about multivitamins alongside of solids. Is it advisable? Do you mind providing your overview on that?
Yeah, so typically speaking, babies don't need a multivitamin or a supplement. Breast milk and formula are very varied in their nutritional components. Now, around 6 months of age, babies' natural iron stores begin to deplete. So it is important to be offering a wide variety of iron-rich foods to your baby. And even if they're not consuming a whole bunch, they're learning about those foods. They're figuring out how to eat it. So you're already on the way. Some babies, especially breastfed babies, do benefit from an iron supplement, but that would be something that your pediatrician will recommend to you based on either or a variety of factors. Babies who are born prematurely may need an iron supplement. If your pediatrician ends up telling you to start your baby on an iron supplement, try not to tell yourself that you have done anything wrong, or that you fed your baby the wrong foods, or that you made a mistake. Some babies just need an iron supplement. It has to do with nothing that they're eating, and it has to do with their genetics. It has to do with how their body transports iron. It has to do with your birth history. If you were anemic during pregnancy, your baby may have a higher risk for needing a supplement. It is completely okay. There's nothing wrong. You have made no mistakes, but some babies will need an iron supplement that will be recommended by their pediatrician. And depending on the state you're in California, they screened my babies at 9 months for iron deficiency, and then again at 12. But then here in Michigan, they didn't do it until 12. So just depending on the state you're in, there will be different recommendations as to when you get the baby gets the little toe prick to check for iron levels.
Thank you for that, and thanks for that response. I know that we have to close out in the next few minutes, but I do not want to get away without mentioning the great things that we're doing together. We are offering a 15% off your purchase at drnozebest.com if you use the code SOLID STARTS. SOLID STARTS. So it should be in the chat, but I wanted to mention that. Great opportunity. As you all know, we're building the modern nursery that supports respiratory health over here. So our NozeBot is our hero product, but we just released an amazing humidifier this year that's the first of its kind that we're excited to get into many, many hands. So please use your coupon and visit us. And I'll toss it to Kim because I know she has something to offer for our audience as well.
Yes, we also have a 20% off your first year of our Solid Starts app with the code NOZE, N-O-Z-E 20. And you can use that at the on our website, solidstarts.com/app. So for anyone that's unfamiliar with our app, you can, there's a completely free version if you're interested, but you can look up hundreds of foods and how to safely prepare those for your baby at any age. And then if you're interested in a more guided experience, so going through allergen introduction, meal ideas, more like tips from professionals, ideas how to problem solve if your baby is doing certain things like spitting or overstuffing or whatnot. We have a guided experience in our app that this NOZE 20 code will get you 20% off for your first year. So go ahead and go to solidstarts.com/app. You can plug that code in Noze20 for your 20% off of your yearly membership.
Amazing. I am so excited that we were able to do this together, especially post-holiday, when I hope lots of parents are at home and we're able to address many issues all at once, especially around feeding or respiratory health. Super happy to be here. Kim, any closing thoughts on your side?
No, I just want to give everyone a big hug and say I hope that everyone's staying healthy. And I wish there was, like we had said earlier, I wish there was more support for new families and new parents out there, because this is a journey. It's hard, and there's a lot of ins and outs, and I wish there was a guidebook, but there's just not. And the best advice that anyone ever gave me when I started my career was that babies are made for new parents, which is true, but more importantly than anything, and I don't care if it's, you know, the best pediatrician in the world talking to you, you know your baby best. So don't forget that you know your baby best. So if you feel like something's not right, keep advocating, keep asking questions. You know your baby best. Don't let anyone convince you that you don't.
And don't feel guilty.
Yeah.
I love to add that, because as I shared with Kim the other day, like, you know, even in their teenage years, when you when you feel guilty for every other thing that you do, it's, you know, you carry that parental guilt, and there's just better ways to cope with it. I'm super grateful for people like you that are out with expertise that can really offer parents the tips and tricks to help them with feeding and swallowing, and that Solid Starts exist for parents like us, and very excited to have you in our orbit, in our partnerships. Thank you for spending time with us, and hopefully this will be another one of many series that we are doing this upcoming year.
Absolutely. Absolutely. And thank you for helping my kids' noses this season.
Yes, 100%. I know. So many sick kids already right now.
Oh.
So as the weather travels, it gets worse.
Yeah. All right, everybody. Have a great weekend and a wonderful
great weekend.
day, Christy.
Yeah. Have a good new year, everyone. Be safe and healthy. Take care.
Bye.